So, so summary, a very, very short pitfall. One, don't confuse the IVC versus aorta. So basically, this is a sagittal plane when you do, ultrasound. Remember that the IVC is going up to the RA while the aorta pushed down to the patient back. So this is, to depict if when you do ultrasound, if you move the probe from right to left, you can actually see aorta. As you can see here, the aorta is pulsatile and has thick white wall and point downward to the patient back. Two, remember that the IVC is cylindrical. So to imagine, another thing to remember is that IVC is cylindrical. So to correctly interpret the results, you have to cut the IVC in half, which of course you will see the IVC in a nicely black tube, as you can see here. However, if you couldn't cut the IVC in half, maybe because your probe position is wrong or maybe the patient position is wrong, what happened is that you would see the IVC is collapse. But it doesn't because the patient is dehydrated, it's because your probe is not in the middle of the IVC. The third thing is interpretation. Remember that when you took a deep breath inspiration or you have dyspnea, which increase inspiratory effort, you decrease the probe pressure so much more when you do a normal breath. So what happened is that there is more drain of IVC into RA, and then the collapse of IVC would be so much more than when the patient is normally breathing with no effort. So if the patient is very, very aggressive breathing, very dyspnea, don't interpret solely on IVC. Rely on other parameters, heart or other labs marker or hemodynamic parameter. Another condition that you have to be careful is when you have increased intra-abdominal pressure or intra-abdominal hypertension. What happens is that when you have a lot of ascites or a lot of pressure in your abdomen, it pushes the blood from IVC into RA so much more that the IVC would abnormally collapse in the inspiration phase. So again, if the patient has this intra-abdominal hypertension, don't interpret solely on IVC. This is a summary of the condition that may increase intra-abdominal pressure. It also includes obesity, severe acute pancreatitis. The patient who have acute kidney injury or on CAPD is also one of the conditions that you have to consider. Again, remember that IVC is only one of the jigsaw in your patient. Be careful to interpret the IVC with other parameters, even with ultrasound or something else. Thank you very much and hope you enjoyed the video.